neurologist in North Colorado. Graduated from the
Thank you very much. Holding the mic like this, can you all hear me okay in the back over there? Okay, great. I'm going to be kind of floating around my computer here while giving the talk, but just to introduce myself, I'm Dr. Tallavajhala, but I have my patients call me Dr. Sunny. It's a nickname I've had since I was a kid. I'll be talking to you guys a bit about toxins and Parkinson's disease and what we know, what we have yet to learn about it. To kind of gauge the audience, I'm wondering how many people here have Parkinson's disease? Okay, thank you. And then how many people here have a spouse with Parkinson's disease? All right. And then people who have family members with Parkinson's disease? Okay. Any healthcare professionals? Okay, great. All right. Helps me know kind of who's in the audience and who I'm talking to. So I'll be talking about Parkinson's disease and tremor. So let's get started. So kind of an overview of the things that I'll be talking about is understanding Parkinson's disease itself, and then talking about environmental influences of Parkinson's, genetic influences, looking at some of the major environmental toxins that we know about and their impacts, and then try and talk about what next steps there are in the role of risk reduction and the role of understanding how it furthers science, and then how policy and advocacy are going to be really important in this realm. So I myself am a movement disorders neurologist undergoing my fellowship training at University of Colorado. I am not a toxicologist or an epidemiologist, so there was a bit of learning I had to do for giving this talk today. So why do we need to understand this? Well, in terms of curing a disease and figuring out what's going on, you have to understand what's causing the disease. You cannot cure something if you don't know what's causing it, and you can't prevent it if you don't know how to avoid what could contribute to it. And so by doing that, you can then further the medical field. You can get through to medical breakthroughs. But what are the challenges if you don't know what the cause is? Well, like I said, it's difficult to cure disease if you don't know the cause. How many of you remember what used to be said about peptic ulcer disease? Anyone? What causes peptic ulcers? Stress, yes. People used to say that it caused stress, and doctors thought so too. So doctors would recommend patients to reduce stress. So they tell those CEOs, quit your jobs, find a new job, find something less stressful. Guess what? They still had peptic ulcers. They still died of bleeding ulcers. And so it wasn't until scientists thought, hey, maybe there's something in the gut that's contributing to the ulcers. They're like, hey, there's this bacteria that could. Other doctors, other scientists ridiculed them. They said, no, there's no way it could be a bacteria. The stomach acid is too acidic. It wasn't until someone actually took bacteria, H. pylori, and then gave themselves ulcers and then treated it with antibiotics that we started to really understand this dynamic. Kind of hard to do in Parkinson's disease space to give a patient or give yourself as a researcher Parkinson's disease through a toxin and see that effect, because it's not as immediate as peptic ulcers. But we'll talk a little bit about what research has been done in this space. And so once you understand what sort of triggers there are that are contributing to Parkinson's, we might have some better methods to both prevent as well as slow down disease progression. This prevention idea of Parkinson's disease is a pretty new idea that's started to come up here in the last year, pioneered by some neurologists that I'll give credit to at the end of the talk. So let's talk about Parkinson's disease itself. So what is Parkinson's disease? A progressive neurodegenerative disorder impacting mostly the motor control and movement first, but also can affect cognition too. Characterized by dopamine loss in the brain, crucial for movement and coordination. Parkinson's disease has been described throughout history. A lot of talks that you'll see, a lot of information will reference the 1817 paper by the describer James Parkinson himself, a surgeon who lived in London and saw patients who had this tremor without action, this stooped posture, slowness of movement, slowness of thought. And he described it in his essay on the shaking palsy. But he actually wasn't the first person to mention this. Galen, famous physician in 175 AD, first mentioned similar symptoms, but didn't give a full description. And as someone born in India, the Ayurvedic descriptions of certain symptoms of Parkinson's have been described back in 700 AD as well, known as Kampa Vata, which is basically tremor due to some sort of Vata pathology. But basically, in that time, they were describing Parkinson's symptoms and treating it with mucunapurines. So even pre-industrial revolution, pre some of the environmental toxins I'll be talking about here, Parkinson's was present if we look through the history books. So when I talk about a lot of these toxin-related things, even though some of the uptick may have occurred after industrial revolution, we should always kind of keep in mind that there was some Parkinson's going on before all of this. So what do we know about Parkinson's and its rise? Typically, median onset around 60 years old tends to affect males more than women. What's interesting is the rates are increasing faster in countries that have higher socio-demographic indices. What that is a measure of the average income, average education rates, and average fertility in certain countries, and the ones that have higher socio-demographic indices, the ones you think that would be doing better, actually have a higher increasing rate of Parkinson's there. Over 60,000 Americans are diagnosed each year, but that's based off of some relatively poor studies and may underestimate that number by about 50%, could be as high as 90,000 Americans. It's very costly to the American healthcare system. Yearly costs of Parkinson's in $52 billion range by estimates. And then in terms of new cases in 2021, there were 11.7, in terms of the number of cases of Parkinson's present in the US in 2021, there were 11.7 million. Now it's thought there's somewhere around 12.5 million cases of Parkinson's. So like I mentioned, this is just a graph looking at that progression over time. So back in 1990, there were 2.6 million people living with Parkinson's. In 2015, 6.3 million. And then in 2021, 11.8 million people living with Parkinson's. So this is a rapidly expanding disease. It is growing quite quickly, and it's actually rising faster than Alzheimer's, and it is now rising faster than lung cancer and stroke. So some of the measures that have gone in to help with prevention and change in those diseases, such as stroke and lung cancer, making smoking lower and optimizing risk factors, talking to patients about how to prevent the disease has actually helped out. It's now made it so that Parkinson's is now winning. We don't want Parkinson's to be winning. So let's continue. So Parkinson's disease progression. So I think it's important to, if we want to figure out what's causing the disease, look a little bit about the symptoms that come on in Parkinson's. So in Parkinson's disease, there's a couple of descriptions that are present. Back in 1988, there was the UK Brain Bank criteria for Parkinson's disease. In 2015, it was updated by the Movement Disorder Society with more specific guidelines to diagnosing Parkinson's disease. Also, the newer ones started to basically help us make better evaluations by discounting a bit of like arthritis injuries and injuries to joints to help us improve our correctness of diagnosis. But typically with Parkinson's disease, it's going to be, you need that one cardinal feature and one supportive feature. So the one main feature you need is that slowness of movement. So your neurologist having you do these taps, they're looking for that first feature of Parkinson's, that slow movement that gets progressively smaller as you try and make it. And then after that, the supportive clinical motor feature is either a resting tremor. So about 20% of Parkinson's patients can have absence of resting tremor. And then additionally to that, you'll have that rigidity, that stiffness in the arms, legs, and then that loss of balance or the postural instability. So you need the slowness of movement plus one other thing to then have Parkinsonism. And then you need to have a supportive feature for classic Parkinson's disease, or what doctors call idiopathic Parkinson's disease, associated what we suspect to be synuclein pathology. So what is that? In looking at pathology of the brain, what is it that's, at least we know, abnormal in association with Parkinson's disease? We know that there is the loss of dopamine-producing neurons in the substantia nigra and also noradrenergic neurons in the locus coeruleus. We know that by the time patients present with their first motor symptoms, that being the slowness of movement, the tremor, those things that I talked about, that they've lost somewhere between 30 to 50% of their dopamine producing neurons. So you're running on 40% remaining of the dopamine neurons that you had before. And then there is this premotor phase where there's some symptoms that happen before patients have the motor features of tremor. Where do these abnormal proteins occur? In the substantia nigra. This is the brainstem. This is a picture of the Mickey Mouse midbrain where the dopamine producing neurons are located. In a healthy substantia nigra, it's going to look nice and dark. All those neurons are present. But in Parkinson's disease, we're losing those neurons. Why are there loss of the neurons there? Well, there's this abnormal protein called alpha-synuclein, which is more colloquially known as the Lewy body. That Lewy body accumulates in these regions and contributes to the neurodegeneration. So in terms of progression, I get asked a question a lot by patients about what stage of Parkinson's disease am I at? My doctor told my family member about their stage in cancer. So do we have a staging system in Parkinson's? Technically, yes, we have a staging system. The staging system tells us about your disease, but it doesn't tell us about where you're going in the disease. Stage 1 is going to be one side of the body affected. Stage 2 is both sides of the body affected. Stage 3 is both sides plus a little balance difficulty, but you can catch yourself. Stage 4, you need a walking aid. Stage 5, you're not able to walk. So it's not really a very specific staging score, and based on how you do with medication, you can jump between various stages. You get DBS implanted, you can jump back from one of the later stages to an earlier stage. And it makes it a bit difficult to really tell a patient where are you at and where you're going to go. It's helpful for us doctors to be able to talk to each other about how severe some symptoms are. Another thing about staging that helps patients a little bit more is understanding maybe how these symptoms progress over time. And like I mentioned, there's some of those early premotor symptoms that we talk about a lot when trying to diagnose patients with Parkinson's, things like constipation, REM sleep behavior disorder, decreased sense of smell, that predates some of those motor symptoms. And there's some theories that some of these symptoms may be an indicator as to what's going on with some of the environmental risk factors that are present. So when we talk about that abnormal protein, the alpha-synuclein, there are a couple of different hypotheses of how it gets into the brain. And what autopsy studies have shown is that if you look at the smell neurons, the olfactory neurons, or you look at the vagus nerve, which is the neuron that goes from the stomach and the gut up to the brainstem, is that in those locations, there's that abnormal protein in those neurons. So we know that in certain pathologies and certain spreads of that Lewy body, it starts in the gut first, the body first hypothesis, and then migrates up the vagus nerve to then affect the brainstem, and then go higher to the motor centers. So that can potentially be that clinical picture of, oh, constipation predating for a long time, and then REM sleep behavior disorder coming up, because that Lewy body starts in the gut, then gets up to the low brainstem where those dream enactment behaviors are located, then gets up to that motor center where the motor symptoms manifest. Then there's the brain first hypothesis. So that's the one where the Lewy body accumulates in those smell neurons. So then once they accumulate in the smell neurons, they translate back to those memory centers, which are very deeply connected with the deep brain movement centers. And so those are kind of two hypotheses that we know that this is how the Lewy body, the abnormal protein, spreads. I'll come back and talk about this sort of vagus nerve smell neuron spread talk in a minute. And then that abnormal protein, we have studies that show we find it outside of the brain. There have been biopsies that show that we see it in the spinal cord and some of the sympathetic ganglia inside the retina, uterus, bladder, skin, all over the place. So it's present. It's helpful for us because now we've started to create some assays to help diagnose the condition and find whether the alpha-synuclein is present in the skin of patients with Parkinson's disease and help give us a hint as to, okay, this is related to what's going on in your case. It's not 100%. Even in some genetic Parkinson's, we see that some of the genetic Parkinson's cannot have a positive result. So that's a quandary that we're still trying to understand. So I mentioned genetic causes of Parkinson's. So we'll talk a little bit about genetic versus environmental influences. So first, I want to start kind of thinking about Parkinson's as a possibly environmentally driven disease. In terms of environmental triggers, we know that there are certain toxins and chemicals that help create laboratory models of Parkinson's disease. But in terms of actually getting good studies for whether those toxins cause difficulty in humans to cause Parkinson's, it's a bit more difficult. But if we're able to make those connections and proofs, then it can help out with creating a model for preventability of the disease. And so genetics also does play a role, but how much of a role does it play? So with genetics, there's the PD generation or PD generation trial. Over 10,000 participants had donated their samples to help us understand whether they had a genetic risk factor for Parkinson's disease. How many people here have participated in the PD study? Thank you so much for participating. In that study, they found that only 13% of patients actually carry a genetic marker, the most common one being LRRK2, after that being Parkin and then GBA. There are some other genetic associations with Parkinson's disease, but actually none of these actually are directly associated with you will get Parkinson's disease if you have this gene. If you have a LRRK2 gene mutation, the chance of getting Parkinson's associated with that is only 20 to 30%. If someone has young onset PD, they used to be told you have a higher likelihood of this being genetic because it started when you were younger. Well, PD generation didn't necessarily show that. From the results we have so far, those with young onset PD still only have a 20% chance of developing Parkinson's disease. So it's not one-to-one, or I should say, those with young onset PD, only 20% of them were found to have a genetic condition. So that tells us that 80% of those young onset patients do not have a genetic risk factor. The entire study tells us that if 13% of the patients have a genetic risk factor, 87% of patients don't have a genetic risk factor. So what's going on with the other 87%? That tells us that this is a lot less genetic than we think about. Alzheimer's is something that is a bit more genetic, but even then, it's only about 46% chance of getting Alzheimer's if you have some of those genes. So all of these diseases are very non-penetrant. To compare a genetic disease you might know about, Down syndrome is 100% penetrant. If you have the genetic abnormality, the trisomy 21, you're going to have Down syndrome. In Huntington's disease, if you have that expansion of the CAG repeat, you will have Huntington's disease. So again, with Parkinson's disease, when we're talking to patients about how much of a role does genetics play, we are trying to discover whether there are connections, but right now the data pretty much shows that we need to do a lot more work than just look at genetics. So the next step is looking at those environmental interactions. Well, there have been some studies that look at the gene interaction between patients who have been exposed to certain, been exposed to certain pesticides, and then changes in their genetic information of a enzyme that helps process how we process medications. the enzymes also not just process medications, but they also process how our body deals with toxins that are present, and how does it clear some of those toxins that should not be in the body. Well, in terms of genetic studies, we've seen that there has been association between higher prevalence of pesticide exposure and higher risk of Parkinson's disease in patients who have certain types of mutations in those enzymes that process those toxins. So there's some data, some correlation that's present there. Some other genetic information that we know about is we have some research on patients who carry the GBA mutation and doing DBS in those patients. We know a little bit more about their outcomes, that they can have some more cognitive difficulties after DBS. It doesn't mean we don't offer DBS to them, but it at least lets us give them the benefit of understanding those decisions about risk benefits. In LRRK2, if we understand that patients have that, we have prognostic information that that tends to be a bit of a slower progressing Parkinson's disease. So genetics has been helpful with being able to understand those genetic syndromes, but it really falls short in giving us information on how does this affect all the other patients who have Parkinson's disease without these genetic mutations. We have some twin studies, and so twin studies are always notoriously hard to really expand upon, but they do give us a good insight into some genetic versus environmental risks. There have been some veteran twin studies that have evaluated the risk of developing Parkinson's disease after exposure to trichloroethylene during their time in service, where one twin may not have had that versus the other having that. And they had shown that there was a 500% increased risk of developing Parkinson's with that exposure as compared to the other twin. So really it tells us that there is this environmental influence on developing Parkinson's disease. It's hard to say if that's necessarily the TCE itself with that single study, but there's more data that we have that can help support that. So what I want to kind of take away from this section is that there is a low genetic contribution to Parkinson's disease, and that we should be thinking more about the high environmental influence of Parkinson's disease and add to the focus there. So what major environmental toxins do we know about? So in terms of environmental risk factors, there have been some good studies that have been done looking at previous reported studies on each individual exposure. And the ones that have some significant impact in association with Parkinson's disease are exposure to certain pesticides and certain solvents that increase the risk of Parkinson's disease. And this table is really small here, but these three categories, the first circle is paraquat, the second one is solvents, and then the third one is well water. And those had a significant association. The other toxins or environmental exposures on there at the very bottom was living in farm life situation, didn't have a significant association with the risk of developing Parkinson's disease. A couple of the risk factors on here, one of them, paraquat, that I had mentioned, is structurally similar to a compound we use in the laboratory called MPTP. Which is a long toxin known as methylphenyl tetrahydropyridine. But that toxin and paraquat are very similar in their structure. And so we're able to induce Parkinson's disease by using MPTP in monkey models and rat models, so that we're able to then test medications and also test our hypotheses on the development of Parkinson's disease. Additionally, there are other risk factors that are looked at on here in terms of solvents. Part of that is looking at things like TCE or trichloroethylene. So I'll start talking about TCE a little bit more. So there are risks to TCE exposure outside of Parkinsonism that has been researched and shown. There's also a big association with certain kinds of cancers, renal cell cancer and non-Hodgkin lymphoma being a couple of examples of cancers that are associated with TCE exposure. And TCE, I have a picture of that compound there. The top molecule is trichloroethylene, and the molecule underneath it is perchloroethylene, or also known as PERC more colloquially. These compounds are used quite widespread in like many occupational roles, industrial roles. And actually previously, we in medicine were using trichloroethylene as well. I'll talk a little bit about that. I won't go through the entire history of TCE, but basically we started making it back in 1910, and it was started to be used in like dry cleaners in the 1930s. In the 1950s, we started to see some brain bleeds in cattle, but even beyond that, the EPA took 20 years after that to really place it on a hazardous substance list before we really knew what was going on. In 1990, the TCE was further regulated, and the European Union basically gathered a bunch of workers that were exposed to TCE and were able to understand, oh, this is a problem in the 90s. So the European Union then 20 years later banned the use of TCE. Now we're in 2020s, 2024. There's been attempts at banning TCE successfully at state levels, things like California, Minnesota, New York. But unfortunately, the global use of TCE is still projected to be increasing. A couple of exporters of TCE are places like China and the UK. Even though TCE is banned in those locations, they continue to export it. So where is TCE used? A very large list here. Just to name off a few commercial products, adhesives, carpet cleaners. This one was interesting. I didn't know about this. We used to decaffeinate coffee with TCE in the past. Also was a previous degreaser, glue, things like that. In industrial usage, dry cleaning uses a lot of this TCE PERC type compounds, disinfectants. In the process of making certain pesticides, TCE is involved here. So there's a lot of uses. In medicine, so I will own up to for the medicine field where we've used TCE, but fortunately we're not using it anymore. You can see the little asterisks by each of these things. The medicine category doesn't use it, but it's still used in the industrial and commercial setting. But we used to use it for anesthesia, used to use it for obstetric procedures back in the 70s, where it would be used to help with pain relief during delivery. There have been some studies that have looked into anesthesiologists potentially having a risk for Parkinson's disease. It's one study associated with TCE exposure. There's a lot of occupations where TCE exposure has occurred. So TCE exposure in, if you imagine using dry cleaning materials, dry cleaners, having that risk of TCE exposure is quite high. In a single study in Europe somewhere, I think it was Denmark, they looked at dry cleaners and their risk of developing Parkinson's disease, female dry cleaners. And in their one study, there was a 1,500% increased risk of developing Parkinson's for those women who were using those dry cleaning compounds. Other exposures there, using mechanical parts, degreasers, so working in the automotive industry, working with computer parts, so in the computer industry, Silicon Valley having much of this too, so a lot of places where this trichloroethylene exposure had occurred in the past. So say I didn't do any of those kind of jobs, I probably didn't get exposed to TCE, so that's probably not an environmental risk for me. Well, TCE can contaminate the groundwater, and there can be some chronic exposure that can be unnoticed. So how does it get there? So after the industrial processing of TCE, it can leak into some wastewater, can get into groundwater. And then when TCE is kind of unkempt and unregulated, it compounds together to form these kind of plumes that then migrate for about a mile or so away. Once they get into the ground in these locations, then the compounds themselves are volatile. And what volatile means is they like to evaporate. And so they evaporate, turn into a gaseous form, and like when they're deep in the ground, they don't like to stay in the ground. Gases like to rise, and so they rise up. And where they can rise is through cracks in floor, wall foundations, through utility lines, get into homes, houses, and then wind spread can help spread it around. So there has probably been a lot of TC exposure that we're just now kind of accounting for and realizing. In 2024, with the previous administration, there was a Toxic Substances Control Act, which basically regulated the use of trichloroethylene and related compounds. That in January of 2025, that regulation has been postponed or frozen. And so we're not sure if they're going to go back on trying to hold off on compliance with regulation of this compound. So the publication is there about how to regulate it. So I would encourage you to look up that EPA if you use products or things like that in your work that could be related to TCE. Look at that guideline because it gives some good metrics that you can still follow even if the government has paused how to follow through on that. So paraquat is a pesticide, the one I had mentioned before, that is structurally similar to MPTP. So the top little molecule on the right there, that is paraquat, and below that is the molecule MPTP. You can see they're very similar in their structure. In terms of paraquat use, what do we know about it? We know that it is one of the largest used pesticides for the production of things like corn, soybeans. There's a map there that shows that in the United States, locations where we've been increasing the use of paraquat and where that's been used. Do you guys see where we're at on that map there? It's kind of, dark, really high concentration there. Things we know about paraquat is that it's known to be the thing that kills what Roundup misses. It's that strong of a pesticide. It has actually been used by people to commit homicide as well as suicide. And then in the EPA, there's a tagline and a label that says that one sip can kill. So that's a pretty stark thing. That I was wondering, has anyone seen that label before here on the right? That, yeah, okay. I was wondering if putting that in, anyone would recognize it. But yeah, that's what the EPA has on paraquat. Unfortunately, as it stands right now, paraquat is not banned in the United States as well. In terms of how paraquat causes Parkinson's disease, this we know through laboratory studies that by giving paraquat, we can create the same changes that MTPT can cause in animal models to create Parkinson's disease. And apparently this potentially was known by the creators of paraquat per The Guardian, which is an investigative journalism site in the UK, but they were able to determine that paraquat in the 1960s had recreated those same kind of exposure tests in rats and rabbits and found that they were able to induce Parkinson's-like symptoms in those. Currently, the paraquat use is highly subsidized by the government, and so there's a lot of taxpayer dollars that are going into paying for the continued use of paraquat in the United States for our agriculture. So there's a lot of health consequences to some of these toxic exposures. With TCEs, I had mentioned before that we've noticed rising rates of cancer. We know that TCE can induce cancer in animal models and has been labeled by the EPA as a carcinogenic compound. There has been in the past decades rising incidence of cancer in young adults, and it's been linked with TCE exposure. If we think that cancer is only being further diagnosed because of screening, well, young onset patients who are getting cancer are not regularly being screened, since screening doesn't necessarily start until age 50. It's not just a matter of an aging population because we're looking at the young population there. So there's a lot of broad health impacts that we need to understand. We understand that there are some geographic patterns looking at pollution in Parkinson's prevalence. This is something that the Dr. Dorsey has talked about in some talks. He had mentioned that there was an association with the timing of the description of Parkinson's. As I mentioned before, James Parkinson described in 1817 the first descriptions of Parkinson's disease. And he was in London at the time, and there's the thought that during the Industrial Revolution, there was a lot of air pollution in London at that time. So there has been some research that's been looking into what are the connections between the prevalence of Parkinson's in areas where there are exposure to air pollution. In terms of looking at geographic maps, there tends to be a higher density of Parkinson's in those locations where you have higher numbers of kind of industrial society. But unfortunately, there's a little bit of a confounding factor that you have a higher population around those urban sites. So it's a little hard to make that complete association, but it's definitely another thing to keep in mind. So I had talked about that gut first, nose first type model of the origin of the disease. And if we think about where those abnormal folded proteins that we know are causing Parkinson's disease are starting in autopsy studies, the Lewy body, originating in the gut as well as originating in the smell receptors. Dr. Dorsey and colleagues had come up with a hypothesis that maybe the environmental toxins may have some association with that model. So in the gut first model, ingested toxins, things like TCE pesticides like paraquat that is on foods, organic compounds that are then getting eaten by animals or eaten by people, are then getting into the gut, contributing to that constipation first, abnormal protein misfolding, and then that abnormal protein misfolding is that domino effect that runs down the line towards Parkinson's disease. In that nose first model, it's thought that some of these volatile compounds like the TCEs evaporating from the groundwater stores are potentially then coming up into our nasogastric region. And so we inhale those vapors that causes dysfunction in the olfactory receptors. Those proteins get misfolded in the nose, and then domino effect, you get the nose first hypothesis of synuclein. The only proof we have related to this is that if we look at autopsy studies of patients with Alzheimer's who have smell loss and patients with Parkinson's who have smell loss, we know that we can see some inhaled compounds, metals that have accumulated there. So things like the platinum in catalytic converters, you can see that on autopsy studies, it's platinum being there in the nasal region. You can also see some evidence of small dissolved lead particles from gasoline prior to when gasoline used to be leaded, now unleaded. So it's a hypothesis for right now, but it definitely contributes to the body of evidence that we have related to some of these environmental toxins and their association. We haven't fully shown, well, we do have the studies that show that we can induce the abnormal folding with some of these compounds in lab animals, but it just wouldn't be ethical to do the same experiment on a human. That being said, there have been researchers in the realm of research for Parkinson's who have worked with these compounds, MPTP, working with animal models. One of them is a movement disorder specialist in South Carolina or Georgia. But he gave a talk back when I was in residency, and he had Parkinson's disease and was also a Parkinson's disease specialist, secondary to the research he was doing in the field. So I'm going to kind of finish off with talking about where's the responsibility and what to do next with some of this understanding that there are these toxins and environmental exposures that have pretty strong associations with the development of Parkinson's disease. So this is reminiscent of some of the industry and is kind of repeating what has happened in history with the tobacco companies. There was previously a downplay on the severity of its risks, but it took a lot of advocacy and research to help show that there was an association between smoking and lung cancer. And after making those associations, we've been able to decrease the production of tobacco and have campaigns to help educate people to not be exposed to those if they don't want to be. And we've decreased incidence of lung cancer. Hopefully, we can do similar things in the Parkinson's disease space with environmental toxins. Some examples of this are, if you think about smoking as well, not just individuals who smoke, but secondhand smoke has been a known risk factor for the development of things like cancer and lung cancer, and risk for stroke and things like that. With the secondhand exposure, it became illegal to, or there were spaces that you were not supposed to be smoking anymore. No longer do you have public smoking in bars, you have designated smoking areas. You're no longer having smoking exposure on airplanes. So there's been a lot of work to try and decrease the risks of secondhand smoke exposure. There haven't been many efforts to try and decrease the risks of secondhand pesticide exposure, things like that. There's this concept I learned about just this week called agnotology. So science is deliberately trying to gather information to produce information and make informed decisions, whereas this study called agnotology is the deliberate production of ignorance. So what some of these companies have done with understanding the risks and basically downplaying it, or tobacco companies downplaying the risks of smoking, to basically advocate for that and produce ignorance. So something we need to monitor for and be cognizant about. And just because I know this is something that will probably come up in questions, Camp Lejeune is usually that big cited question mark about, hey, what is the story behind Camp Lejeune? And so there was a water contamination incident at this military base in Camp Lejeune. The personnel there needed to wear well-pressed uniforms, so there was a dry cleaner on site. And then between the years of, I can't remember, 1958 and 1970 something, or 1983, so about 20 to 30 years time, there was exposure of TCE, some of those dry cleaning compounds, in the water at Camp Lejeune. That led to studies that have been done seeing that there's been a 70% increased risk of Parkinson's disease amongst the cohort of patients at Camp Lejeune. And then also we've seen that there's increased cancers amongst people and children who were living at that location as well. And so that's resulted in the government basically subsidizing and allowing for them to basically be able to claim that they had damages done. But that's not the only situation where this sort of TCE compound has kind of come in, and that sort of responsibility for some of these exposures needs to be accounted for. So how do we go forward with trying to understand how it manifests in disease and prevent disease? So thinking back to sort of that nose first versus body first type spread of the pathology. Obviously, if we want to try and decrease exposures via these routes, we have to understand that it's happening. So things that help decrease that sort of environmental toxin exposure, things like air purifiers that have carbon-based filters can be very helpful for removing those volatile compounds. It can help decrease the overall exposure there. Things like filtration systems or basically cleaning up water with carbon-based filters can help remove some of those carbon-based compounds as well, so that the water you're ingesting doesn't have as much of it. Checking or advocating to have water sources tested for some of these exposures with TCE solvents or pesticides getting into it, specifically testing for it can help with reducing getting it into your system. And so I just bring back up this sort of natural history of progression of Parkinson's disease, just to kind of think about, well, if this toxin is accumulating at first with some of the earliest signs as early as 20 to 10 years before patients start to get tremor, that's sometimes the time where we're trying to develop studies for drugs to try and intervene for patients. But in terms of research that's being done, not enough research is being done on how to help slow down the ongoing exposures that are going on for patients in these prodromal phases. So with these new therapies that are coming out to try and treat patients before they have onset of symptoms, those studies, if they don't consider the environmental effects, may have further negative studies in the Parkinson's disease space. So that would be unfortunate if we spend a lot of money trying to do trials on patients who may develop Parkinson's if they're still developing Parkinson's because we're not addressing a different factor contributing. And so just a quick slide on treatments. This is a treatment slide from a Grand Rounds presentation that was given in the past year. And I think in terms of what sort of neuroprotective treatments that are present, we know about the benefits of exercise, and hopefully every neurologist you've seen has told you about the benefits of exercise in Parkinson's disease. But we need to take some steps further to potentially talk about other ways to have neuroprotection in the role of understanding more about these toxins. The first step for that is going to be advocating for its research. For every $100 spent on Parkinson's disease research, 2 cents are spent on the prevention of Parkinson's disease research. In terms of how do we generate that sort of funding to get that information, we can look back at history in diseases that have no longer plague us today. So in polio, there was the March of Dimes. They were able to raise lots of money, and the amount of money raised towards polio research was in the billions. And they were able to help develop the vaccine, and then we no longer have polio. For drunk driving, in the 80s, we had a pandemic of drunk driving, and now we've prevented tens of thousands of lives and have made driving drunk socially unacceptable. In HIV, they had multiple awareness campaigns. You may remember a phrase, a slogan called "Silence is equal to death." And so they would speak out, they would advocate for their disease, and they were able to raise billions of dollars in research to help with identifying treatments and preventative strategies. In HIV, there was a quote that Dr. Dorsey mentioned in a talk where they mentioned silence equals death. In Parkinson's disease, silence is equal to suffering. And so there is ongoing suffering if we don't talk more about these environmental exposures. In terms of legislative successes, I mentioned that EPA Act related to decreasing toxin exposure, but then in 2024, there was also a national plan to coordinate research, funding, and prevention. I have another slide on it that mentions it, so I'm going to jump ahead to it. Yeah, so bit more about how we really need to talk about this issue more. But yeah, there in July of 2024, the National Plan to End Parkinson's Disease was signed into Congress and approved by Biden. The idea was to basically create a bureaucratic division that had stakeholders that were patients, physicians, and advocates in the field to help with identifying key legislative issues to help end Parkinson's disease. The last update on that was back in February, where they were looking for nominations for staffing the panel, but it is now September, and since then there hasn't been any updates published on changes in that. So that's something that we can do, is reach out to our Congress people about what's the plan, what's the status of this national plan to end Parkinson's, and what meetings are going to continue to happen. We should continue to start to understand or start to raise some support for the idea that Parkinson's has a lot of environmental influence and is not only age-related. And some ways to help focus on prevention. There is something known as the Parkinson's 25 that was recently published in the book, The Parkinson's Plan. I just picked it up last week in preparation for giving this talk. It came out at a very good time, and you guys apparently have a raffle for a signed copy of it over there. Within that book, there is 25 things you can do to help prevent Parkinson's disease. And for those who already have Parkinson's disease, it is not just a method of prevention, but how can you prevent further accumulated damage on the brain? How can you work with those 40% of dopamine neurons that are still remaining while you prevent further exposure to some of these things to help out? And they mentioned that all sales of the book are being donated towards research in this space specifically. Other methods for accountability and awareness, there's pdplan.org. They've got some resources that are coming up to try and help with identifying these risk factors. They have a section on there where patients and groups can submit, hey, we think that there's maybe an exposure going on here, or there's multiple people who are having similar symptoms start at the same time, to start to try and identify what associations are present in those populations. And then there's pdavengers.com, and they've been a group that have been advocating and speaking out for Parkinson's representation for a while now, and helped with getting that national plan to end Parkinson's going. Some hope for the future. In the Netherlands, there has been a study, the Rotterdam study, that showed that there's been a decreasing incidence of Parkinson's there, with between 1990 and 2007, 60% drop in the incidence of Parkinson's disease. There have been retrospective studies to figure out why was that happening there, and things that they had done was banning paraquat, banning TCE, and basically trying to promote healthier lifestyles too. So if it worked in one country, then why can't we make it work here too? So I guess that's mostly my talk. We are really trying to learn and figure out what's going on with Parkinson's disease and environmental toxins. So hopefully by speaking with Congress people, understanding, supporting books like the Parkinson's Plan that are advocating for some of these methods are going to be helpful towards creating a new future. And so on the right here are Dr. Dorsey and Dr. Okun, who wrote the Parkinson's Plan. I had the pleasure of meeting them when I was at a course on movement disorders called the Aspen course that all movement disorder specialists go through. And then they were inspired by Dr. Caroline Tanner, who was a movement disorder specialist who went back to do additional training in epidemiology to then learn more about what's contributing to Parkinson's. So all of them have contributed significant work in this field and are definitely advocates. So I definitely express my thanks to them. Yeah. Questions? Also,
Have any questions? How hard is it to get, like water or soil tested?
That's a fantastic question. I am told it can be tested. So looking at resources online, I was a little curious about this. I don't know the exact way to test it, but according to talks that Dr. Dorsey has mentioned, you can have water specifically tested for things like TCE and pesticides as well. And so commercially getting that testing, I'm not too sure about, but to be able to do the studies that show that these are present in certain locations, that testing has to be done.
I read or heard recently, like if you live in close proximity to a golf course
Mhm.
or something that you have higher risk, Parkinson's or other.
Yeah,
I assume because of the lawn, you know, the chemicals that go on the lawn. I don't know.
yeah. And so that study was done, the topic was talking about pesticides and golf courses or golf courses in risk of Parkinson's disease. That study was done by Dr. Dorsey and one of his colleagues. He was one of the authors on the paper. But basically in Minnesota, in Mayo Clinic, Rochester, they do a good job of keeping track of how many patients are being diagnosed with Parkinson's disease and their incidence, as well as where they're located. They then looked at not only proximity of those new diagnoses to golf courses, but they also looked at proximity of those zip codes to differences between them having well water versus treated groundwater exposure. The hypothesis was that with the pesticides that are being used on the golf courses, of which pesticides tend to use on the scale of 80 times more pesticides than commercial farming does to maintain their lawns. The thought is that that spreads into groundwater and then is distributed. So they showed that living within, I think, a 2-mile radius of golf courses increased the risk of Parkinson's by 127%. Again, hard to say that's completely correlative because there's some limitations on the study related to people moving in and out of that location. After reading that study, I looked back at my history of living near golf courses during my training and residency. I lived 1.5 miles away from a golf course, which I liked to play at. And then I also, unfortunately, lived within 1 mile of my water treatment facility as well. And so the study actually showed that having those two factors together increase the risk. But there are certain things water treatment facilities can do to help reduce and better clean the water from some of those pesticides. You just have to make sure that those treatments are being done. Part of the advocacy that's mentioned in the Parkinson's plan is like talking with your golf courses about your support for them and that you would want to know when they're doing their pesticide spraying, or can they use less dangerous pesticides? Because they definitely have an investment in you all who are basically going there to help make us happy too. Question back there?
Well, do any of the home filters, like you're treating the water at home, or any of those contain these pesticides out of our water?
Yeah, so I had mentioned earlier carbon containing compounds. So anything that does use some sort of carbon-based filtration is likely to have some benefits. So things like Brita filters and things like that should improve it, but it doesn't fully solve the problem. There's some talks about reverse osmosis being more helpful. I just need to research more. I've only had a short time to really learn about this topic, so I'm definitely not an expert. But it is one of the Parkinson's 25 in that book I had mentioned that they mention as one of the strategies that you can utilize. But they also quoted filters ranging from price of $10 to $10,000. So they left it a little bit vague in the book. Yeah, so for a diagnosis of young onset Parkinson's disease, the average age of diagnosis is around age 50. Basically, if you have diagnosis before the age of 60 or 65, it qualifies as young onset. Second to that is there are various ages of young onset PD. I had just found out like 2 months ago incorrectly that Michael J. Fox had onset of his Parkinson's in his 30s. I used to think that he had it in his 50s. I was wrong about that. So there's definitely a wide variety of ages for that young onset. I heard that the presentation is being recorded.
I don't know if they'll be able to see.
Okay, the slides. Yeah, I will say in terms of what's written on the slides is not terribly important, but I've talked about everything important on the recording. So if you want to distribute the recording, then it basically, I say everything that you need to hear about. Yeah. Oh, and that comment reminded me of something. So I imagine many of you may go to your doctors after this because I've been on the doctor's side of this, where patients go to these talks and then come ask me questions about what do you think about this. And in terms of if a patient comes to me and talks to me about, oh, I heard this talk or I'm reading this book, The Parkinson's Plan, about environmental exposures, and what do you think about that? I think what I'll tell patients is that I think it's safe to try and incorporate some of these additional steps to help prevent Parkinson's disease, but we definitely need to advocate for more money, more time being spent on research in this space, because we don't have enough research on this space and the research is not focusing here. And so this is where a lot of importance is. As a doctor, I'm not sure how much I could do to prescribe your local golf course to stop using certain pesticides or enforce exposure or adherence to the EPA policies of TCE. So it's definitely something that's a little bit above my head and something we have to all work on together to understand more about this. All right. Well, thank you all for the time.
We have a bag and that's our gift card.
Thank you so much.
And a cup. Oh, sorry. Thank you, Dr. Sunny.